Imagine this, you've spent years developing a life-saving medical device or a pharmaceutical product. You're about to enter a new market worth millions, but one incorrect term in your legal documentation or a mistranslation in your user manual derails everything. In this video, I'll show you why accurate translation of your legal texts and technical documentation isn't just a box to check off your list, but rather the key to getting regulatory approval and closing multi-million pound international deals. So, before we begin, my name is Aaron Butler. I am a freelance translator specialising in high-stakes industries, for example, medical device, pharmaceutical and legal. So why listen to anything that I have to say? Well, I've been doing this for the last 3 years, working in regulated industries. I've worked on multiple projects for global medical device and pharmaceutical companies and governing legal bodies. But most importantly, I help companies like yours navigate strict regulations, avoid legal risks, and expand into international markets with confidence. So in the medical device, pharmaceutical and legal industries, everything hangs on precision. A single mistranslation in your regulatory submissions, your clinical trial reports, your distributor contracts, or your instructions for use can delay market entry, can trigger compliance issues, and expose you to lawsuits, meaning that years and years of development are now in jeopardy. Now, thankfully, I don't have any personal examples because, well, I'm good at what I do and I don't make costly mistakes, but I have seen others do them, and I've laid out a few here for you. So number one is a German medical device manufacturer was fined €500,000 because critical safety warnings were mistranslated in both French and Spanish. That's a serious fine. Number two was an FDA warning letter cost a medical device company $5 million. I'm going to repeat that, $5 million after mistranslations delayed their product launch. And the last one, a single translation error triggered a recall of 10,000 medical devices, resulting in a $50 million loss for the medical device manufacturer. Now, these mistranslations were masquerading as simple errors, but in fact they were multi-million pound disasters. Like I said, precision is key because regulatory compliance is not a joke. So when you're getting your legal or your technical documentation translated, you should always pay the price and never ever pay the associated cost. That means avoiding automated translation tools and low-cost agencies because they often lack industry-specific knowledge, understanding of regulatory terminology, as well as understanding of the different legal frameworks across jurisdictions. Now, when you're submitting technical documentation or negotiating distribution agreements, close enough isn't good enough. So what are the consequences of that? Well, for one, an incorrect translation of a mandatory versus an advisory safety instruction can result in recalls, fines, or worse, patient harm. And another is that a poorly translated contract clause might make your entire agreement unenforceable, which is not what you want. For example, I once helped a medical device company prepare one of its medical devices for entry into the Irish market. The task was to translate the device's instructions for use into Irish, as is required by Irish law. Now, the device itself related to a delivery catheter for cardiac catheterization, which would help with angioplasty, which is when a tiny balloon is inflated at the tip of the catheter to help push any plaque build up to the artery wall, which would then help blood flow through said artery. So as you can imagine, it was serious stuff and the translation was difficult enough, and thankfully I was up to the task. So once I translated it, I proofread it as always, then I sent it on to the client. They eventually came back to me saying everything was a-okay, which was happy days, because if I didn't take that seriously, not only was I putting years of development at jeopardy or in jeopardy, but if somehow that device got onto the Irish market and there was a error present in the instructions for use, I was putting both the healthcare provider and the patient at serious risk. With that being completed and everything being a-okay, the client was able to get a distribution deal because as I've checked, it's still on the Irish market, and for them, because they're based in France, to be distributing their product around Ireland, it has to be distributed by someone locally. Now, how much the deal was worth, I don't have a clue. Why? Because the client didn't deem it necessary to share that information with me, and to be honest, I'm not surprised that they didn't. And because my task was done, I was happy enough. As long as I got the A-OK to say, well done Aaron, thank you very much, and I received payment for my effort, I was happy. But some clients may want to tell me how much it's worth, they may not. I wouldn't be surprised if none of them do. Now, if you work in the medical device, pharmaceutical or legal sector, you cannot afford to trust the translation of your legal or technical documentation to generalists, machines or LLMs, aka AI. You need an expert, someone who understands and specialises in these subjects. Luckily for you, that's me, and I offer premium translation services, ensuring regulatory compliance and legal protection for your international deals. So don't waste time, send me an email for a free consultation. You will be able to find my email address below, and together we will make sure that your texts are accurate, compliant, and that you are ready for your next big deal.